Right, you're still on the AM show. And yesterday, Sunday, September 26th, was World Environmental Health Day, one of those many global days commemorated each year to highlight an issue that the world needs to pay attention to. And I was saying that considering the many issues that we have, we probably should have a day set aside for each of the many issues. But let's focus on World Environmental Health Day. The theme is prioritizing environmental health for healthier communities in global recovery. It comes as the world continues to fight the COVID-19 pandemic, alongside several other crises, including the impact of human health from climate change. Now, here in Ghana, there are a myriad of environmental health issues we need to tackle, most of them being basic hygiene issues. What we're seeking to focus on here on the AM show is appreciating the magnitude of our challenges and deciding what realistic targets we can set ourselves as a country to trying to tackle the problems. So joining me for the conversation this morning is Florence Kuchi. He's the Environmental Health Officer of the AMA, and then Dr. Juliet Oheming Intiama, who's a US-based environmental health scientist. We're hoping to go out there. Nimwa will be stepping out there to get to bring you a picture of what the situation is. But let's start with my guest in studio, Florence Kuchi. Good morning to you.
Good morning, Uncle Israel.
And oh, please don't call me Uncle Israel. don't join anyone and the rest calling me Uncle Israel.
I call everyone.
Otherwise, I'll call you Auntie Florence.
Every man is an uncle to me.
Okay, Auntie Florence,
Sure.
and bring it on. So, by the way, for those of you out there who do not know, Florence Kuchi is the Environmental Health Officer with the AMA, who is with the Joy Clean Ghana campaign. So they are the ones who go out there, the TV in Sama people. That's what I think we can call you. But it's good to have you on the show. And great work that you've been doing, by the way, with the Joy Clean Ghana campaign. Yourself and your colleague, Mr. Asitanga. All right, so before we get on, I know that yesterday you guys had a commemoration of a sort. How did it go, and what was the commemoration about?
Yeah, thank you. Good morning. Let me say a very good morning to our cherished viewers. So yesterday was the World Environmental Health Day. Let me say yesterday was the 10th anniversary of World Environmental Health Day, but in Ghana, yesterday was our maiden commemoration.
Oh, okay.
Yes, we have never had it in Ghana.
Yeah.
So yesterday, we were happy, we were lucky to have it, and then it went well. We were really overjoyed. We had a float.
Okay, float.
Yeah, we had a float from the old Accra Metropolitan Assembly office around the High Street through to the Makwala Market, Tudu, and then we climaxed the Deba at the new AMA head office. Yeah.
And it would have been, I would want to imagine that it would have been excellent as you went on the float. You were going through clean streets, clean gutters, and all of that. What would you say about that?
It's not easy. We still have a long way to go when it comes to our clean environment that we are trying to project. I will continue to always talk about our attitude.
Yeah.
Myself, somebody out there, we are all guilty.
All of us, yeah.
Yes. Some people don't see waste as something bad. Waste is something that can lead to sickness. When you are sick, you spend money. Not only thinking about spending the money, but productivity comes down. So when the environment is not clean, when you don't have a clean environment, it goes round and come back. Everything within the country is a standstill. How do we manage our environment? The waste that we are talking about. How are we going to do it? How are we going to come by so that we can have a clean environment as everybody is waiting for? We need to change our attitude towards sanitation and hygiene. Yeah.
Indeed, you make the point. You see, where we have people who are, if you decide to be filthy on your own or litter on your own, it's not so much of a problem as to when you decide to do out there in public, litter in public, and bring a lot more people into your filth. which is what, when you hear, which is why when you say that this is an attitudinal problem, it's something that we really need to also look at. But yes, much as it's an attitudinal problem, how have other people tackled this? They tackle it by using law enforcement.
Yeah. So
you litter, you fine. You're fined and you pay for littering. But yes, in our part of the world, people do these things and get away. But I think if we're deciding that we're going to tackle or deal with people who litter and get them to pay fines or prosecute them and all of that, I think we'll be making some headway. But this is just the beginning of the conversation. Now let's look at World Environmental Health Day. What do you seek to do with the commemoration of World Health Environment?
So World Environmental Health Day is a day set aside for the environmental health workforce to reflect and project their roles to all of humanity.
All right.
Environmental health, looking at the theme for this year, it came at the right time, prioritizing environmental health in healthier communities for global recovery. I would say for Ghanaian recovery.
Yeah.
Yes. So you can see that environmental health is best achieved at the local level. That is why in Ghana, they place the environmental health practitioners under the Ministry of Local Government, Decentralization and Rural Development. But by placing the workers there doesn't solve the issue. If you are sending somebody to a war and you don't give the person the equipment the person is going to use for the war, you go to the war and then you'll be defeated. Why am I saying this? You cannot handle or achieve environmental health issues when you neglect the technical officers behind ensuring that laws are being enforced. As we talk now, environmental officers in Ghana, we are hanging. We don't know where we belong to. So we are just playing, what will I say, our own music. We are doing our own thing. Nobody is manning us. So there are simply no resources. We are just trying as much as possible that we will help because it's a cause we have decided to go by. Yeah. And we don't want to use those things as challenging. We continue to complain about our challenges. So we are just keeping quiet. Look, everybody, when you go to the decentralized system, you go to the MMDA. We have so many departments at the MMDAs. When you trace them from the MMDAs, you go and end at a ministry. But when you trace the environmental officer, you get to the regional, we are missing there. So nobody carries our challenges, our issues to the national level for them to know that these are the things these officers need to ensure that the clean environment we are looking for is attained. You go to the environmental health sector, officers don't even have, what will I say, not even a motorbike to go out for monitoring. An environmental officer can walk about 15 to 25 kilometers a day, just ensuring that you do house-to-house inspection, you educate people. So there are a lot of issues that we think if really we want to solve environmental health issues in Ghana, we should try as much as possible and resource the officers in charge of environmental health and sanitation in Ghana. When you go to the assembly, environmental health officers are like the police officers. When you look at the Criminal Offences Act 29, 1960, yeah. We are referred as constables. We have the right to arrest, detain, and prosecute anybody who go contrary to sanitation rules. But how can you arrest when you are not equipped? You cannot use a mufti to go and arrest. You are not a CID or personnel.
But then you can bring on board the police.
Yes, you can bring on board the police. Bringing on board the police, you need to pay. Look, environmental officer, when you are taking somebody to court, you take a person to court. When the person doesn't appear in court, you take a bench warrant. You have to take money from your own pocket to effect the bench warrant if you want to seek for the help of the police. You have to rent a car, that is a taxi, that you put the accused person in and send the person to court. When court even finds the person is not able to pay, or the person is convicted to prison term, you are sent, it is you who have to look for money to send the person to the prison. When you get there, you need to do something before they will even admit the accused person.
You have to do something there as well.
So you see, environmental officers, we are just paddling our own canoe. Nobody is helping us to paddle our canoe. And it is not helping. Until we solve the root cause, the symptoms will not be out of us.
So we know the problem, and we have the officers to deal with the problem, but the officers are not equipped.
Yes, they are neglected.
All right.
Nobody is thinking about the environmental health officer. Look, it will interest you to know that when you even go to some of the MMDAs, environmental officers don't have a good office with furniture. They have just one, some are even sitting in containers with just a bench. You don't even have that moral courage. It demoralizes you to even go out to talk.
Now, let's look at the issues that we have to deal with. If you had all the resources, what are some of the issues you'd want to tackle?
For instance, if we have all the resources.
And we can just itemize them.
Yes. One, we are talking about having a clean environment. Let me say, one Ghana to be the cleanest city in Africa.
Yeah.
What do? First of all, we need trucks that will be able to do what? To collect refuse. We need landfill site. When these refuse are collected, they will be sent there. Yeah. We need to intensify waste segregation. Waste is wealth. When you go to other countries, they are practicing the circular economy. It is helping them. Okay. Waste is wealth. You do the 360 waste work.
Okay. So clean environment.
Yes.
That's one.
That's one. Then we have to ensure that we plant trees around. That is greening our communities.
Our environment, yeah.
That in that case is we are working towards climate change. You understand? Yeah. We have to ensure that we don't allow stray animals straying all over.
Okay.
Yes.
That's another one of our problems.
Yes, we have
stray animals.
Stray animals. The tree planting that we did in June, you cannot count almost all of them. Where are they? Stray animals are feeding on them. It's the duty of the environmental officer to ensure that these stray animals are controlled. But you do not have a van.
Yeah.
How do you ensure stray animals?
So the third issue, stray animals.
Stray animals. And the third one, the fourth one is the law enforcement. We need to be equipped. At least when we are going to court, it should be ease. Now, some assemblies do not even have what they call the bylaw. They cannot even get money to gazette the bylaw. I think the bylaw should be gazetted nationally or regionally for all MMDAs. Yeah. Because the bylaw is one of our weapons. Yeah. So when you have the bylaw, so the fourth one is the law enforcement. Okay. Yes.
Now you mentioned four things. I haven't heard you talk about noise pollution.
I'm still coming there.
That's also part of
that's also part. Noise pollution is part. Open burning is also part. Okay. Open burning is also part because you don't have to burn anyhow. Indiscriminate dumping of refuse into drains and public places is also another. Okay.
You've listed a number of issues. I want you to hold on. And we're joined via Zoom by Dr. Juliet Ohiming-Teria, who in Tiamwa, Dr. Juliet Ohiming-Teria. She's a US-based environmental health specialist. Thank you very much. And I'm sure you're in the US, right? Okay, you'd have to unmute.
Can you hear me?
Yes, I can hear you. Okay, so you're in the US.
Yes, and just a little correction. Dr. Juliet Ohiming-Teria.
Sorry. Dr. Juliet Ohiming-Teria. Yes, and I can imagine that you've had to wake up very early to join us for this conversation.
Yes.
Okay, thank you. Thank you very much, Doc. So I don't know, I'm sure you've been following the conversation with Florence Kuchi all this while. Now, we have a certain set of problems when it comes to environmental health. I can imagine the problems will be different when it comes to the US. What are some of the issues that the US is confronted when it comes to environmental health?
Okay. Thanks, usual, for having me. And I think before I go ahead to even talk about the US I would say that I'd like to say kudos to Florence and her team. They are doing a great job. I've been following some of their monitorings, and I can bear with her that it's not been easy at all for her working in such an environment. And I wish that we even shift the attention to Ghana. But I'll briefly talk about the US and then.
Before you go on, Dr. Ntiama, so it's good that you brought this up, and I think we should take a moment to celebrate Florence Kuchi. Because yes,
Definitely.
I've been telling her that she's a hero, a heroine, and people appreciate the work that she's doing. I was telling her that she's a superstar, but she doesn't believe it. It's good that you've confirmed, and now she knows that she's a super. So now you know you're a superstar.
Yeah, Florence, you're doing a great job.
Even the US.
I think I watched you go to one of your sites where they still had panda trains and they were discharging it into a lagoon, right?
Yeah.
And yeah, you are really getting on the ground, and I wish there was all the support for you.
Thank you.
All right, so let's
doing
look at
Yeah.
first world environmental health problems.
Okay, so when we look at developed countries like the US, of course, they have, really gone ahead and making sure that, the connection between the environment and the people and even the environment with itself is as much as possible sustainable and ensuring, public safety. So one area, for example, which I would like to really focus on in our discussion is wastewater treatment, for example. What the US tries to do is constantly review its standards that it's given to municipalities or cities to meet. So, for example, they monitor the health of rivers that are receiving wastewater from, different cities. And as they monitor the rivers and see that, okay, the health of the river is maybe declining, they try and tighten the regulations they have given to some of these wastewater treatment plants or these cities. So for them, I would say that they are at a stage of maintaining what they have, the standard they have established over the period. Okay.
Okay.
And then once in a while, let's say if an industrial facility discharges something indiscriminately, then there are fines, there are court charges. So I'll say they are more or less in a state where they are trying to maintain or monitor the systems that they have put in place over the years.
Okay, so Dr. Ntiama, that is the US situation. I would want you to look at the Ghana situation when it comes to wastewater treatment.
Okay, great. So, Israel, if I should ask you, and maybe even Florence, this morning when you took your bath, when you flushed your toilet, where do you think it'll finally end or it'll finally get to?
So it will go through the drain and then eventually end up in the gutter outside, and then eventually it will end up in the Udo or something, yeah. A river body.
No. Because
okay, so
no, because I have a digester in my house. So when wastewater is treated, then we use it for greening in the house.
Okay, so Dr. Ntiama, this one, Florence wants to show us levels, so it's okay. When I grow up, I want to have a digester in my house as well.
I think that's the purpose of, our discussion this morning, right? To learn and to, expose or bring out some of the better things we can be doing as a country. So when we look at wastewater in Ghana, I think that when we look at the statistics, and with this, I'm talking about after the flash, right? When we look at the statistics, less than 50%, and it won't even be close to 30%. And I'll break it down in due course. Less than maybe 30% is treated. This is what that means. If you look at Accra as a whole, prior to 2017, when people who have, let's say, septic tanks, right, when even the septic tank is full and a tanker comes to dislodge it, it drives straight to the Lavender Hill and dumps it at the seashore.
Okay. Let me check with Florence. Do we still have that happening? I thought we have a treatment plant somewhere there.
Now, so I said prior to 2017.
Okay, right, sure.
So in Greater Accra, now we have the Accra Sewage Systems wastewater treatment plant, right, that treats the fecal sludge. But even with that, not all, fecal sludge generated in Greater Accra is treated, because there are some that will be way far away from where the treatment plant is located.
Yeah.
And we still have, open defecation going on, so not all of it is tracked or collected. When we look at other regions, they are yet to even have such a facility like that. Kumasi, I think it's about to be on the line, if I'm not mistaken. But apart from these two major cities and work so far, all the other regions we have in Ghana, the wastewater, the fecal sludge that we produce is not properly treated. What are the effects of that? What it means is that somehow they find their way either in a water body or somewhere else. And what are the impacts of that? They affect the health of those water bodies that they are dumped in. The fecal sludge has lots of organics, so it's going to use up oxygen in some of these water bodies. It also has pathogens. So pathogens, that is disease-causing organism, right? It's also going to spread easily. I mean, we're here and we saw that almost 160 people could die from cholera, and cholera is a waterborne disease, right? So these are some of the effects of not treating the fecal sludge that we collect. And that is even away from the gray water that, Israel yours ends up in the gutter. But in the US here, when you flush, when you bath, any domestic wastewater you produce is piped to a wastewater treatment plant. So, and then once it's at the wastewater treatment plant, it's treated in such a way that resources are recovered from it. So water is recovered and put to good use. Nutrients, which, if the discussion ends there, I can talk about, and even biogas is produced from there. So similar to what Florence will have in her home. But you see that in Ghana, for you to have something like that, it means that you, the individual, have to invest in something like that.
Yes.
But if the country had a policy or a mindset to really protect public health by making sure that, no wastewater gets into contact with people without it being treated. If the country had, a strong policy to make sure that, to see wastewater as a resource, and so we are recovering as much resources from it as possible, then those mindsets and those policies are what will trickle down to effect the things we will do to make sure those things happen.
Okay.
So,
Dr. Ntiama, you've said something that's quite instructive. You're saying essentially that when I bath, or here in Accra, when we bath and the water flows out into a drain, in the US, you're treating that as a resource.
Yep.
So something that you can actually make some money off it. It's a valuable item. I mean,
exactly.
So you won't let it just go into the gutter and go away, but it's piped to the treatment plant.
Yes.
And I can imagine that if it is treated, you're going to get fresh water out of it and some other things.
Yeah, and the fresh water derived from the treated wastewater is used for irrigation. So if we even look at our situation in Ghana, we see, or we always talk about vegetable farmers always using unsanitary
Yes, water from,
wastewater,
yeah, gutter water.
to water our vegetables. If we had these wastewater treatment plants strategically positioned, there could be these vegetable farmers growing their
The
vegetables
produce in that
along the
vicinity.
discharge,
Okay.
yes, along the discharge of these wastewater treatment plants. And what they'll be using will be treated wastewater that is safe to really use for that purpose.
Okay.
So that's why I was saying it's a whole, policy mindset and understanding of waste as a resource. And when we think of waste as a resource, normally people may think of, plastic waste, recycling, and, all those things. But wastewater, the water that we are putting in the drain, going almost, nowhere proper, it's a whole resource that we are throwing away that we could put to good use for other things.
And the indiscriminate disposal of the wastewater, as you were saying, also generates diseases and creates unhygienic conditions. Let me come to the studio and bring in Florence in this conversation. So we've seen the way the U.S. would want to treat it, and other developed countries would want to treat wastewater. In your home, it's something that you're doing. Did it cost you a lot to do that?
Yeah, because it is just a unit. It did not cost as much. Yeah, it did not cost as much.
Well, but it's some significant...
Sure. So talking about, Auntie Juliet mentioned policies. Let's come to Ghana and ask, when was the last time we reviewed our sanitation policy? The sanitation policy was 2010. It's now 11 years. A lot of things have changed in it.
Yes.
We need to look at our sanitation policies. That is why I said, if you want to have a clean environment, it's costly. Health is not cheap. Health is very costly. But when you invest in it, you can easily recoup. Just as she said, in our initial conversation, I said waste is wealth.
Yeah.
Whether liquid waste or solid waste. When you recycle it, you get something from it and put it into a different use. You recycle the water, then you use it for what? Irrigation. You get gas out of it, then you use it for what? And you use it for domestic use. All these things, you invest, then you recoup. But we are always afraid to invest. That is one of our main...
It's the case of being afraid to invest. Dr. Ntiamwa, would you agree with Florence that we are afraid to invest?
I don't think we are afraid to invest. I think it's a matter of priorities, what we think, is of priority to us as a country. Of course, if you see health as important, you will invest in it. If you see waste treatment or environmental health, as important or as a priority, you invest in it. If you see sports as a priority, you invest in it. And also the other thing is, I think that as a country, we also do not have a good understanding of how the environment works and its link to health and also its link to wealth. I think if we understand these three things very well, how they are interconnected, and so like I said, so the economy, if we see how they are closely interconnected, then we, when our governments even talk about economic boost and all of that, we'll be hearing, environmental sustainability in it or environmental health in it. I think we don't have that understanding, so it makes us focus on other things without prioritizing environmental health. If we realize that...
Dr. Ntiamwa, I want to differ on this. I don't think it's not the case. It's a case that we don't have an understanding and we don't want to prioritize. I think there are just too many problems and we can't figure out how to address the problems. And so we're going about it in a touch and go manner. We attempt to want to do something about it, but we know we're not doing anything about it. Florence, am I lying?
Do you know, just as she rightly said, sanitation, environmental health has a close interconnection with economy. There's no country that can grow, your economy can grow boostly without checking on sanitation, because sanitation is the backbone of every country growth. All others are the rifts. Immediately you neglect sanitation, environmental and sanitation, you cannot grow the economy straightly. For instance, if your country is dirty, it will discourage tourism. And we know a lot of income or a lot of capital is raised from tourism.
Yeah.
When your environment is dirty, health, it will affect the health of the people. Talking about food safety, you can have very healthy food products, but if you prepare the food in a dirty environment, the food will end up being contaminated, and you'll be eating contaminated food, and it will have an effect on your health. Talk about agric, talk about transport. So before, just as she said, if we don't prioritize environmental health and sanitation in the country, all others, they cannot work properly. We would think that we are doing this, but environmental health will come back to ask us questions. What did you do about me?
From the conversation I've had with you, it's clear, as I was saying, that we seek to attempt or appear to attempt to want to solve the problem. But we're not solving the problem, because if you're saying that there are environmental health officers who are not equipped enough to do the job, it's an attempt to address the problem, but we're not addressing it.
Yes.
Okay, Dr. Ntiamwa, we've talked about one aspect of it, which has to do with wastewater treatment and fecal matter treatment. One of the other challenges that we have in Ghana has to do with indiscriminate disposal of waste and littering. How is the U.S. tackling that, or how has the U.S. tackled that?
Okay, so I'll say that even in the US, I've seen some littering. I'll be honest. I've seen some littering, but, the rate of littering is not, as it is back home. But one key difference between, the US and Ghana is the availability of things that will discourage, let's say, littering.
Right.
So there are bins, or what they call trash cans here, advantage points.
Yeah, we also have some bins here.
But Israel, I bet that I can walk from, I stay at La Paz, right? I can walk from La Paz to maybe Nyameche and not see a bin. So
no, I'm not disputing that, but we have some. They may not be that many, but we have some.
So they are not enough. And then the other thing, one of the key things that we see in our littering in Ghana is plastic waste, right?
Yes.
In the US, one of the things that's one of the policies that they have, with any bottled water you buy, you see on it that you can return it for 5 cents.
Okay.
So that is an incentive for people to, keep their bottles, their plastic bottles
for
a while in it.
You can return the plastic bottle, irrespective of the size, for 5 cents.
I think if I had a one here, well, as an environmental person, I try to cut down plastic bottle use. So I use reusable mug. But if I had one here, you see that they'll write on the bottle, you can return for 5 cents, and then it'll have the address where you can send it to.
Let's hold on. Let's do some calculations. So 5 cents.
Yes.
If the dollar is 6 cedis, and you have 5 cents, you can return it for 5 cents. So 5 cents will be.
I think I got one here.
So essentially, I mean, that's a lot of money actually. 5 cents. Here in Ghana, I think we have some plastic bottling recycle thing. As in, you can return bottles for something, don't we?
No, but you see, at the US, it's written on it. Return it for 5 cents.
Yeah.
In Ghana, it is not written on it.
Yeah, this one is even 10 cents.
Oh, 10 cents. Let's see.
Yeah,
let's see that.
This one is even 10 cents.
10 cents.
Okay, so this one you're returning for 10 cents.
10 cents. 10 cents. 10 cents. 10 cents. 10 cents. 10 cents. 10 cents. 10 cents. 10 cents. 10 cents. 10 cents. 10 cents. 10 cents. 10 cents. 10 cents. 10 cents. 10 cents. 10 cents. 10 cents. 10 cents. 10 cents. 10 cents. 10 cents. 10 cents. 10 cents. 10 cents. 10 cents. 10 cents. 10 cents. 10 cents. 10 cents. 10 cents. 10 cents. 10 cents. 10 cents. 10 cents. 10 cents. 10 cents. 10 cents. 10 cents. 10 cents. 10 cents. 10 cents. 10 cents. 10 cents. 10 cents. 10 cents. 10 cents. 10 cents. 10 cents. 10 cents. 10 cents. 10 cents. 10 cents. 10 cents. 10 cents. 10 cents
Yeah.
But how much is the water itself, the bottle and the water itself?
The bottle, it's 50 cents, right? 50 cents or so. Yeah.
Wow.
Yes.
And 10
So
cents, you
it is
get 10 cents
almost
for.
Mm-hmm.
Okay, but
Yeah.
this is a
So
policy. Yeah.
the policy and the rationale is to help cut down this. And even with that, there are a lot of incentives to use reusable bottles. So when you go for any occasion, any conferences and all of that, these reusable bottles are given for free. And one key thing is that you realize that as you walk through airports, as you walk through, a number of places, there are water dispensers available where you can, fill up your reusable bottle.
For free.
So
for free.
for free. So I mean, the all the incentives are there for you to not go in for this in the first place. And even if you go in for this, there is an extra incentive for you to return it for a little money. And then when you've returned it, like Florence mentioned, segregation, it's important that we even segregate. So at the end of the day, you realize that between these two countries, the waste generation and even the littering that will occur will be quite minimal on this end compared to, let's say, in Ghana, right? So that is one of the things that they've done to cut down. And depending on the state you are in, you can't have, let's say, a plastic bag for free when you go to do groceries. In California, if you forget to take a reusable grocery bag, you have to buy the plastic bag, what we call polythene bag in Ghana. But in other states, in some states, once you go for groceries, you'll be given the grocery bag for free. But in other states, you have to buy it. So that's also a way to discourage you from buying the polythene bag or plastic bag and to bring something reusable. So things like that.
Yeah.
So that's why I'll go back to policy and the understanding we have. And Israel, I'll still debate with you as to whether we really have the understanding, because if we have the understanding, then we'll do things in tandem. If we don't have the understanding, then like you said, we'll touch here small, we'll touch here small, we'll touch here small. Let me give a good example between even the wastewater I was talking about and agriculture. If we have an understanding that, these things can be connected or these things are connected, so we want to recover resources from the wastewater. One of the key resources in wastewater is nutrients. Nutrients is what we use as fertilizers. So if you don't retrieve the nutrients in wastewater and you even dump it, when it gets to, let's say, a water body, you see that it causes what we call algal bloom. You see the water become greenish, a bit greenish and all of that, and even be killing the water. So it has a lot of nutrients, principally nitrogen and phosphorus. When you put this wastewater through a treatment system and you retrieve this nutrients from it, and even you do your digester and the nutrients collect in the sludge or digestites that comes out of it, then you use it to fertilize lands. So in the US, we have a classification for whether it's class A biosolids or class B biosolids. And I don't want to go into technicalities, but all I'm trying to say is, even depending on how you've treated the wastewater, there are some that become so safe they can be touched and used at home for home gardening or plant flower pots and all of that. Yeah. And there are those that can be applied on massive lands, wait for about maybe 15 days so that any vector attraction is reduced and all of that. And that is what you use to fertilize your land to boost agriculture. Yeah. So we have a system where if that understanding is not there, we have a great minister going to look for fertilizer or going to invest in fertilizer manufacturing or something. if there is not that understanding that you can also get agriculture, you can also get fertilizer from this wastewater that you're allowed to go waste, then you just be wasting resources here and be throwing away resources
to import fertilizer, so that when there's COVID and you can't import the fertilizer, then the farmers won't have any fertilizer so that they can cultivate their crops. Now, one of the things I want us to do before we end the show is for you, Dr. Ntiama, to propose some ideas, give us some ideas, because our problems are a lot. And you're talking about we having an understanding. So you tell us what you'd suggest that we should do to address some of our issues, or where to start with. I'll come to you for that. But back to the studio with you, Florence. I'm hoping that at the end of this conversation, we can come to some understanding how we want to tackle this. Let's get out onto the streets there and go to Enimweni Mado, who is out there to give us a picture of what the situation is like when we talk about sanitation. And Enimwa is at Sanitation. So Enimwa, you take it over. What's the situation where you are as far as environmental health and sanitation is concerned?
Okay, Israel. So we're at Sanitation Market this morning, and we have been here a few times. And over the years, we've watched as they've cleaned up their act and gotten a rubbish disposal system in place that actually works and provides a cleaner market. So that's what's happening at Sanitation. If you look to the right side, or if the camera can just pan to the right, you should be able to see that the place is quite clean. It looks like it's been swept this morning. There are 2 incinerators of rubbish. And formerly, you remember that the rubbish here would usually be on the ground and be really scattered and just be really horrible. But right now, it's actually properly packed in the incinerators. And it's been like this for a few months. So there is a system in place. In terms of rubbish, it looks good, but of course that's not the only thing that has to do with environmental health. There's also the fumes from the cars and the trotros and all of those things, and the carbon emissions. And a trotro just passed by me with black smoke coming out of his trotro. And so there's still a lot more work to be done in terms of making sure that our cars are roadworthy and that we're bringing air pollution down to a minimum. But I also have with me the environmental health, the head of the team, analyst, the head of the environmental health team, Mr. Joseph Asitanga. He oversees Okankwe South in terms of the environmental health. So I'm going to talk to him about some of the things that they've put in place to get, the area, less untidy, get the rubbish in place. And just by the way, I'm sure as you're watching, you can see that not a lot of people are wearing masks. So that's still an issue. But that's just by the way. Good morning, Mr. Asitanga.
Yeah, good morning to Madam, and good morning to your listeners. Good morning to everybody. And we thank JoyNews for all the efforts and time that you are putting more emphasis on sanitation issues. Yesterday was a celebration of World Environmental Health Day globally, and this day has become a very important day regards to the environmental health and sanitation activities in the whole world. And there is a saying that goes with that every healthy country, sanitation is the requirement for the growth of the economy and the health and well-being of the people. So Environmental Health Day was marked yesterday just to signify the importance and how governments should place much priority on the management of waste, both liquid and solid waste, human health, the environment, the ecosystem, the water bodies, the forest reserves. All is made up as the environment we are battling with. And who are those to preserve and keep it safe for the health of the people? It's me and you. And it lies on our own responsibility as individuals of the country to put up efforts to make sure that we carry the role as an individual to protect the environment that we find ourselves. Because the day-to-day report of diseases at the OPDs in the various hospital facilities is as a result of poor environmental sanitation. When you go to check on the record tells you clear all the diseases that are reported daily at the various hospitals are all preventable diseases, which me and you and everybody concerned can protect and prevent it from occurring. So it lies on our responsibility to take sanitation into our own hands. Sanitation should be part of our daily activity, such that wherever you are living, business, home, whatever it is, ensure that the first priority that you have to wake up to attend to is cleanliness of your immediate surrounding.
Okay, Mr. Sitanga, so the disposal of waste and rubbish has been one of our biggest problems. We know that it's in the disposal of rubbish and things that even causes the choking of gutters, which then leads to flooding and all of that. What can we do so that we can reduce the rate at which waste is disposed of improperly?
What we can do, and successive governments have put all adequate measures in place to ensure the reduction of waste found on our public drains. What did we do? That is why all successive governments that have been in power have prioritized sanitation as a major issue, a core policy in every government that have taken over. And what did they do? They made sure that sanitation issues are privatized and is given to the private sector for management. And that is the call for Zoom Lion. That's the call for J. Stanley Owusu. That's the call for all the waste management companies in the country. As we speak today, the whole of Accra, the Gama area, Greater Accra metropolitan area, all the districts have been given an accredited waste management contractor, a private person responsible for collecting, disposal, safe transportation to the landfill site. So for instance, Okaikwe and for that matter, Kanesi Market is the eye of the whole city. It's a transit center. And therefore, because of that, government have seen it and made it a priority, given the management of waste within the Kanesi Market to Zoom Lion, who takes sole responsibility in collecting and disposal of waste within Kanesi Market here. And you can see that because of their involvement in managing the waste within Kanesi Market, you can see tremendous improvement of the waste that is always left uncollected here. This morning when we got here, we would have been flooded with waste all over. But you can see that they are busy working. You can see the floors or all the waste is in the container. Within the next hour or two, the truck will come to lift it and replace another one. And this is some of the measures that government have put in place. And for that matter, the Environmental Health Directorate in charge of waste management have also put in place to reduce the disposal of waste into our public drains.
Okay, you talked about the landfill sites, and we remember that a few months ago, and intermittently some of these conversations come up, that some of these sites are full. What's the state of that? Do we still have space to be throwing away rubbish? And are we going to start thinking about, recycling and creating, using the waste, properly and reusing it for things that will make a difference, or are we still just throwing rubbish away?
Yes, because of the challenge of land acquisition by government and the challenge of proper management control tipping at our landfill site, that is the call for the recycling, the siting of composting plants. When you take your way towards Kolbu, we have a place there designated Arikof. Arikof is a place acquired by Zoom Lion, okay, at the old Fadama area, close to opposite Kolbu. All the waste, you see it here, it goes there, and segregation takes place. Segregation of the waste takes place there. Serious segregation of waste goes on there. After the segregation, we make compost there. We get plastic there. We get metal there. We get all the other components of waste which have other uses. And they are all channeled through the various recycle use that comes out as a finished product for reuse again. And the article there, when you get there, you can see that that is some of the measures that help to reduce the waste, the spillage of waste in all the streets. Like those days, you can go and you will roam in and see them.
Okay, so what we want to do now is we want to just take a brief look around the markets and check out the drains and see what those are like. So Izzy, I'm going to hand over to you and then we are going to go around and do that. And we'll come back as soon as we're by the drains.
Thank you very much, Nimwa, for the great work that you're doing. And looking at the Kaneshie market, this is a remarkable improvement on what the situation used to be. And Florence, when did this place look this clean?
Okay, so this place looked this clean when we started Clean Ghana campaign.
Okay.
Yes, because we went there several occasions with Clean Ghana campaign. There was even a day the market women threw plantain at us.
Oh.
Yes, because we were telling them
they are filthy.
They are filthy. And they are also telling us that it's our duty to ensure that the waste there is collected. Formerly, there used to be only one skip container there. But due to the excessive visit and show, there was a consultation with the waste collection company that is there, and they were asked to increase the number of skip containers there. So as you see, there are 4 skip containers. So 2 are placed and 2 are on the track. So when they come, they will put the 2 down, and then the ones that are full, they will take it again and then go for. So the work goes on. It's like a 360. They start, they go and come, continues. It is not only at Kaneshie market, even at Awegbuleshi market. It's used to be very bad than Kaneshie market. But when you go there now, it is also improving. So I think Clean Ghana, we are getting impact. It's making some headway. But we just have to see that, just as you said, we will have to focus on one thing and say, this is what we want to do. We ensure we get the results. When it's done, we leave it and then touch another one. That is what we will do.
Let me bring in Dr. Ntiamwa. Hello, Dr. Ntiamwa. So you've seen the situation at Kaneshie. I'm sure you are aware of the Kaneshie problem. That Kaneshie used to have a lot of garbage heaps and unsightly situations there, unsightly scenes there. I'm sure you're also pleasantly surprised by what you see.
Yes, I am. And I would say kudos to all the team behind this. This is really pleasant to see. When I was in Ghana, I frequented Kaneshie markets lots of times, and this was not a picture, I used to see. So this is great. There's progress.
So you see, we're getting there.
Oh yeah. we will get there.
We don't have a lot. We don't have a lot of beans, but we have a few. So we'll get there. But I would want to come to you before we wrap up the show to tell us, as I indicated earlier, what are some of the things you think that we can readily handle to resolve our environmental health challenges?
Okay, thanks, Israel. And I think since we are wrapping up, I'll just correct one thing too. So I'm actually an environmental engineer, not environmental health practitioner.
Okay.
Yeah. So one of the key things, I think, everything starts with understanding. So from there, then we can, do things right. So education, mindset shifts, and this is not just for ourselves, but including our leaders. I think when that understanding and that mindset shift is there, to see waste as a resource, and, if we see it as a resource, then we guard it, jealously, that we wouldn't let it go waste, or we wouldn't just let it go without.
And Dr. Ntiamwa, sorry for cutting you, but talking about education, I'd want to believe that it also starts at the school level with the children and giving them that mindset.
Exactly. Yeah. So we need to have a lot of education on this, to see waste as a resource, and also to see that waste, although it's a resource, it can also be harmful. Just as we can think of with fire, you can do a lot of good stuff with fire, but if you allow fire to just be it can cause problems. So waste, if you allow it to just be there, it can cause diseases, it can cause, illnesses. But if you see it as a resource and divert it to the rightful place, then you can recover the resources from it. So we need much of education on that level. And I'm glad you brought in that, starting from scratch is very important. And then for those of us who are also already grown up, having these discussions also helps to enlighten us and, other educational platforms that we can think of. And so that would be number one for me. The next thing I think we can do, almost immediately is we are planning cities, right? We are building communities. There are some communities that have not sprawled out yet. For those ones, we need to think of this wastewater management, like I said, right from the onset.
Yeah.
So that for communities that will be a bit densely populated, we have these sewer connected lines where we are going to provide wastewater treatment plants for them. You know that in Ghana, we have about 4% population connected to sewer lines. So their gray water or the, bath water or whatever goes through a pipe to a treatment plant. And that, I think, is in somewhere like maybe Akosombo, all those well-planned towns in those days. Yes. So we need to go back to some of those plans for when we are thinking about communities that, are yet to really come up.
So the new communities we are developing, we should have that as a composite of the planning of those communities.
Exactly. And then for, communities that are already there, we still need to make sure that we are, as much as possible, reducing the contact of, people with this wastewater that we produce. So we are providing wastewater treatment plants. And like I said, in Accra, we only have one main one at the moment, right? And other regions are yet to have some. Even in Accra, we need more of it. We need to decentralize that bit so that a truck will not have to drive so many kilometers to get there. And in siting these wastewater treatment plants, we make sure that we are doing it with, even vegetable farmers in mind.
Okay.
So that now they'll shift from using unsanitary wastewater to water the vegetables we consume, but now use treated wastewater that is really reusable and it's fit for that purpose. Right. So that is doable once we, prioritize it.
Sure.
And then one key thing too that I want to highlight is we have open drains in Ghana. And it's, it creates a whole lot of issues because, people dump things. We're talking about littering. People dump things anyhow, and all these get blown away into the drains. Now we can have covered drains, but before we can really have, or when we are thinking of having covered drains, we need to make sure that it will not get all the silt collected in it. It will not get all the silt collected in it at rapid rates. So we need to create more green spaces. When we have more green spaces, trees and green grass and all those things, then we've covered the soil, right? So when there is even rain, there's not washed the soil or the silt is not washed so much into these drains. And all that will be in there will be the water that can easily flow. Because one of my colleagues, civil engineers, told me that, Julia, the reason why we try not to cover the drains is because there is so much silt out there that, if we cover it, silt is going to accumulate.
It'll be a lot more difficult to dislodge the silt.
Exactly. So that's why I said, thinking of the interconnection between everything we do. So the covered drains and the green spaces. The green spaces will help rainwater to infiltrate the soil, so not a lot will run off. And then those that run off will go into the drains without so much silt. Okay. And I think that's one of the key issues we have. Yeah.
Thank you very much.
I wanted to talk about landfill sites, but I think because of the time, we can
But
talk about
thank
them.
you very much, Dr. Juliet Ohiming Intiamwa, an environmental, US-based environmental engineer. Environmental health engineer. Thank you very much for your insights. And there's some things that I'm sure that Florence Kuchi would go away with. So yes, you've heard, Dr. Intiamwa talk about all the things that she thinks that we can do. But I also want to come to you and ask you how you think that we can, what are some of the things that we can readily look at and tackle so that we can attempt or to be seen to be doing something about our environmental health? Charlie?
Just what she said about the greening. We've even mentioned, our waste management director have mentioned this several occasions at our management meeting, talking about constructing of drain. We should try to green around the drains to prevent silt from filtrating inside into the drains. That is one. Then another one too, I think, is we need consultation, intersectoral consultation. When the government is doing something concerning sanitation, he should consult the technical officers. It shouldn't just be maybe because this person can do this or this person can do that. I talk about the environmental officers being hanged. When you go to the local government ministry, there should have been a directorate for environmental health at the local government ministry, so that when you have your report, challenges and way forward, everything will be collated, sent to the national side, then they will look at it and forward it to when they have national committee meetings, and some of these things can be looked at. So they should look at creating such a directorate there, so that reporting can flow. There shouldn't be a block of reporting somewhere. And then one thing is, we can also have waste traps. We can have waste traps in our drains, so that when it rains, these traps can trap plastics and other waste that are coming. So they don't go to choke at a place, so that they can have free flow. We can also have water retention ponds at the high side, because Accra is on the receiving end. When we have water retention ponds up there, it will also help in reducing our flooding.
I'd want to believe that these are ideas that, I mean, you've already talked about.
Yes.
Except, nothing is happening. And for anything to happen at all, it has to start with a resource.
That is it.
Resourcing
environmental health officers, ensuring that the technical officers are being resourced. Even if every MMDA should have environmental health, or we are not even a department at the MMDA, we are still a unit. We don't even have our own budget. So everything we do there depends on IGF. If you send a memo and there's no money, you cannot do anything. So they should resource the officers so that we will work. We are ready to work. It's the cause we have told, and we want to work. I'm happy when I go to the field and I educate somebody, the person changes and do good things. There's this saying I always say, it's only the environmental officer who prays that our clients in the community change and live in clean environments so that they don't fall sick. Yes.
All right. Thank you very much, Florence Kuchi. Auntie Florence
Thank you,
Kuchi, Environmental Health Officer with the Accra Metropolitan Assembly. We appreciate the time and all the work that you're doing with Clean Ghana and the benefits we're seeing out there in Kaneshie, Agbogbloshe, and other parts of the municipality. So thank you very much.